Hi, Be Health Empowered family. Thank you so much for coming back for another week of Excuse Me, Doctor. I'm Dr. Melissa Clarke. Welcome to this space that we have been having such a wonderful exchange of ideas and discussions with a variety of people, with your comments and your questions. And we're having another great week lined up for you this time. Welcome to my Facebook family, all the Facebook livers out there waiting for you all to come into the room, get comfy, pull up a chair, have your favorite snack and or beverage with you. Same for my YouTubers out there. All the YouTubers, remember to hit the red button, subscribe to the channel. And we are just happy that everyone is able to join tonight. I know that we probably are excited because this is going to be a global edition. We have three people lined up from other countries who are going to talk to us about their experiences with COVID-19 and everything, all the changes that they too have had to deal with, just like we have. I know there's some Jamaicans out there, some South Africans out there listening, some folks from the UK. So, welcome to the international family. We're so excited to have you. We're going to start very shortly. Everybody get comfortable. Just waiting for everybody to sign on. I see you coming on into the room. Good to see you. All right, wonderful. Well, like I said, I'm Dr. Melissa Clarke. Welcome to Excuse Me, Doctor. And as usual, we are going to kick it off this week with our weekly recap. There's been a lot going on, and we have to get all caught up. So let's get started. So this week, top of the news, very important. You all may have known about vitamin D and how it's been promoted in terms of the research that's been done on it to show the role that it plays in immunity. Well, there's even more good news about vitamin D and COVID-19. It's been shown that with vitamin D and COVID-19 that individuals who had low vitamin D levels before. Okay, one moment. I think we need to do something with our audio here. All right, one moment. I am going to stop the broadcast and I'm going to come right back. Sorry about that. Let's get started again. All right. So, our weekly recap. So, vitamin D has been shown to have a very possibly protective effect when it comes to COVID-19. We've seen that with one study that 77% of people who had, let's back up, that with people who had a vitamin D level that was low prior to the pandemic, they have a 77% increased risk of becoming COVID-19 positive as compared to people who had a normal vitamin D level prior to the pandemic. And that's really important. We've also seen that even apart from COVID-19, without with respiratory infections in general, that if you have a low vitamin D level, you're again at 70% higher risk for getting respiratory infections. So what does all that say? It doesn't necessarily say that vitamin D per se is protecting you, but we definitely see a correlation. So now is a great time to get with your doctor and hopefully get your vitamin D level checked so that you know where you're starting off from. Normal doses are somewhere between 600 and 800 international units a day, depending on your age. Older people actually need slightly higher doses. And it's important to, again, have your doctor monitor that. You want to get to somewhere between 45 to 60 nanoliters, nanograms per milliliter, as far as a level in your bloodstream. So keep in mind, vitamin D, work on it, make sure your levels are all straight. You can also get, of course, vitamin D from sunlight, not just from supplements. You can also get it from food like fatty fish. So very important to remember. Now, COVID-19 and weight, also a correlation that we've been seeing where people with overweight or being obese have a much higher risk of getting COVID-19. For people who are overweight, it's about a 44% higher risk. For individuals who are obese, it's about almost 100% higher risk of getting COVID-19 than somebody who is of normal weight. Obesity is a disease. That's important to remember. And as a disease, it's one of those underlying risk factors that no matter what your age, puts you at higher risk for COVID-19. Again, now is a good time to develop a plan with your doctor to try to work on your weight, increasing exercise, eating foods that have lower sugar, lower salt content. Scientists are actually using this as a reason to call on governments to better regulate the food industry in terms of higher fat, higher sugar, and higher salt contents to make sure that they're brought down to reasonable levels in food, and also to call on cities and states to address the issues of food deserts in certain communities where you can only find where you can't find healthy produce and healthy food and fruits and vegetables, and you only find processed foods and liquor stores and things that are not good for your health. So they're really calling on municipalities to start to address these food deserts and make sure that food distribution of healthy foods can be accessed by everyone. So the next thing with our weekly recap is asymptomatic or silent spread of COVID-19. Now, I know this might be old news because everything's happening so fast now. It seems like ages ago that the WHO said that for people who have COVID-19 infection but don't have symptoms, that it's rare that they pass it on to other people. That was just last week that they said it, but it's been since you and I have been together. So I wanted to make a point of saying that they've since walked back that statement. And really, I'm not sure what they were thinking about. I think it was because they're seeing with contact tracing that they're not finding a lot of asymptomatic people or silent spreaders passing it on to other people. But that's just one small window, one small piece of the puzzle. We know from many other studies, especially the ones from China, that silent spreaders, people who have COVID-19 infection and look perfectly fine and feel perfectly fine, it's thought to up to 40% of spread comes from those people. That's why we're wearing face masks. That's why we're keeping physically distant from people who may look perfectly fine, but are definitely able to spread the virus to others. So again, govern yourself as if everybody you meet could possibly be someone who could pass the virus on to you. So the next item, 60-60. What does that mean? So if 60% of people wore face masks properly, and those face masks were 60% effective, we could shut down the spread of the virus. So that's what 60-60 means. And the cloth, the double layered cloth masks that people are making are approximately 60% effective at keeping the virus away from you and keeping, most importantly, you from spreading it potentially to other people if you are infected. So keep that in mind. It's very frustrating, I know, because many of us have been going outside. We've been having protests in our respective towns, cities, and countries. And the protesters, are obviously, it's a very important issue, police brutality and racism that protesters are protesting about. But many of them are, in their enthusiasm, not remembering to wear masks, correctly. We've even seen people over Memorial Day holiday or out at restaurants or in stores and malls not wearing face masks. Many states, even though, especially the ones where the cases are rising, they're not mandatory, so people are not wearing them. And it's very frustrating because we know that masks can be very effective at stopping the spread. So please keep that in mind. Please continue to wear your face coverings. And now, I mentioned the protests. Unfortunately, now we're seeing that some of the protesters are now starting to test positive, and even the National Guard who was deployed in the protests, some of those individuals are testing positive. We know one's from DC, individuals in Lincoln, Nebraska from the National Guard are testing positive. And then we've seen in Seattle, they actually tested the largest cohort of protesters, about 3,000. They found about 1%, which is not that many, but still to be noted, have turned up positive thus far. It's also important to keep in mind that 22 states in the United States are seeing increases in cases this week. They're not necessarily linking them to the protesters. They're linking them more to what happened a couple weeks ago with Memorial Day and the weather getting warmer and people getting out and interacting more. But we're thinking that there's probably going to be another spike in July because of what's happening now with so many people being out on the streets. And again, we don't look at cases so much when we're trying to understand what's going on, because that can be a result of increased testing. What we really are looking at are hospitalizations, which lag by about a week or so behind what's happening with community spread, but it's a very reliable index of, what's actually happening in terms of people getting really sick. And so we've seen 11 states this week with increases in hospitalizations. Texas, the Carolinas, Arizona, where hospitalizations are up 49%. Arkansas, where hospitalizations are up 88%. And again, about 11 states that are having these increases in hospitalizations this week. So very important, again, this is not over. Again, you or all of us may be tired of the coronavirus, but the coronavirus is not tired of us. So continue to bring your A game when it comes to having a plan to keep yourself and your family safe. And then finally, when should you get a test for the coronavirus if you think you've been exposed, such as going out to the protests, or hearing, for example, that you may have been exposed to someone who is now positive? Well, it's not good to go run out the same day and get a test. You want to wait 5 to 8 days, because if you get a test within the first 4 days of being exposed, 67% of the time that test will be wrong. So you might actually have the infection, but it's not going to show it 67% of the time. That's huge. When you get to day 5 to 8, the accuracy of the test improves up to 80% of the time it's accurate. So it's still missing about 20% of the cases, but you have a much better chance if you wait 5 to 8 days after you've been exposed. So that's really important to remember. All right, so that is our weekly recap. We are going to move now to our weekly debunk. And there are a lot of myths, a lot of stuff circulating out there. So it's really never a problem for me to find something to debunk. This week, it has to do with Android phones or Android users and iPhone users. There's a rumor out there that if you're an Android user, Google is going to sign you up without your knowledge for contact tracing. And same with iPhone, that they're signing you up without your knowledge. And as soon as you turn on the phone, if you're COVID-19 positive, it's going to broadcast it to everybody. So that's partially true, but for the most part, not true. The reason that got started is if you're an Android user and you go in your Google services settings, you will see that it says contact, something about contact 19, COVID-19, I'm trying to remember, exposure notifications. That's what it is. It says COVID-19 exposure notifications. And for iPhone users, if you go in your settings, also in location services, you'll see something, the same language being used. Now, that does not mean that you are automatically enrolled. You first have to download a contact tracing app. Those are not even yet available for download in the United States. I believe they are in the UK, but not in the United States yet. Secondly, you have to give your consent for your information to be shared. Thirdly, you have to enter whether you're COVID, if you test COVID positive. Then what will happen is that app will share the information with public health authorities, and if there's somebody who comes within a certain range of you, I think it's 12 feet, it will notify anyone who comes within a certain range of you that they have been exposed to someone with COVID-19. It's totally anonymous. No names are mentioned. There's some kind of algorithm and random number generated. So it's totally anonymous. And my thing is this, people are concerned about Big Brother and all that kind of stuff spying on you. Well, the reality is Google, and Android, Apple, they all collect information on us, right? So if you decide to use this app or this opportunity to either receive information about the fact that you've been exposed, or if you're COVID positive, share that information with anybody who might come around you, I say you're doing a public service. You're actually helping to save lives. You're helping to potentially reopen economies sooner so that people can get back to work. So you're really doing a public service. I personally don't think it's something that is anything to be afraid about. I personally, when the contact tracing app is available, I will be downloading it on my iPhone. So that's that. That's the weekly debunk. All right, so let's move on to our panelists for tonight. I am really excited about this this international get-together that we're having. And just as a little bit of background, I want to mention that the 3 countries that we have representatives from have very different profiles right now when it comes to COVID-19. So in the U.S., of course, we're over 2 million cases, 115,000 deaths, unfortunately, but over 850,000 people have recovered. And I'm also going to mention that the death rate in the United States is about 35 people per 100,000. When you get to a place like the UK, that has had about almost 300,000 cases, the death rate per 100,000 is 63 deaths per 100,000 people. And South Africa, which has about 70,000 cases, the death rate is about 25 per 100,000. Jamaica has had a little over 600 cases, and their death rate is only 0.3 per 100,000. So again, very different profiles. But I think we're going to hear, as we talk to our guests tonight, we're going to still hear some common themes about how this pandemic has affected everybody. And we're going to hear maybe about how different countries have addressed this differently and maybe even learn from each other. So on that note, I want to introduce everybody. Our first panelist is Daniel Ngwepe. He is South African, but he's also a world citizen because he's traveled extensively. I've known him for many years now, from the 10 years of time that he spent in Washington, D.C. at the South African Embassy. serving with the South African Foreign Service. Now he's a senior director at Visa. He oversees their relations with governments in 44 sub Saharan African countries. He's had a 25-year career in public affairs across various fields, and we're delighted to have him join us. Thank you so much for being here, Daniel.
Good to be with you, Dr. Melissa. Thank you for inviting me.
Absolutely. Our next guest is Clive Thompson. He is from the UK, but he is born of Jamaican parents. He's a photographer, but he's had a wide range of career highlights, including in the civil service in the UK, working in the telecom industry. He has expertise in change management, communications, training, consulting, and marketing. He's a family man with a 14-year-old daughter, and he is a volunteer who has been honored with his service with the Queen's Award in 2019, just last year. So thanks for joining us, Clive.
Good evening, and thank you for having me.
Absolutely. And now, last but not least, we have Ryan Foster, hailing from Jamaica. He is an accomplished corporate executive with multiple awards for his transformational leadership achievements. He is the CEO and Secretary General of the Jamaican Olympic Association, also president of the Skateboarding Jamaica Limited, and a director of the Jamaican Paralympic Association. He was formerly the CEO at Tasty Limited. So for you patty lovers out there, I know you know what that is. And he's also been a lecturer at the University of West Indies. I have no idea where he finds the time, but he is also a family man as well, with a fabulous wife and two adorable children, and he is celebrating his anniversary tonight. So thank you so much for taking the time to join us.
Thanks, Dr. Melissa.
So I especially want to just highlight the fact that in South Africa it is 3 a.m. in the morning, and in the UK it is 2 a.m. in the morning. So again, you all have definitely gone beyond the call of duty to join us, and thanks so much for that.
Okay.
So just to start off, I want to ask each of you, and maybe start with Daniel, how has the pandemic affected you personally and professionally?
Well, again, Mel, thank you for having me, and Ryan, congratulations on your anniversary. The
Thanks.
the pandemic is new. This virus is new. Unfortunately, I work for a company that very early on adopted a work from home policy. So thank God, none of my family members has been affected. I work from home. We try and practice hygiene as much as we possibly can. We wash our hands. We sanitize anything that comes into the house. We practice social distancing, and we avoid unnecessary errands. We don't go out when it's not necessary, and really just doing the best that we can. Thank God we still have jobs. And as I said, we are able to work from home. It's not going to be the same for many people on the other side of the pandemic. So, in that regard, we've been very, very fortunate to be staying safe and to be staying healthy in the midst of this crisis.
Wonderful, wonderful. What about you, Clive?
It's been quite a shock, to be honest. In terms of my particular profession, I work mostly as a freelancer. I went into lockdown about 3 weeks before the official lockdown at the beginning of March in the UK. And this because as the pandemic started to grow around the world and concern, a lot of organizations and certainly a lot of my clients were being very, very cautious. So they were limiting the access to their buildings and properties from what they would call people outside of their normal staff. So for me, lockdown started about 3 weeks prior before the official lockdown. And then, of course, the schools have come out. So I have a daughter who's been at home now coming up to about 4 months, and that's been very difficult for her. And I can see the psychological change So there's been an income hit for me, and there's also been a change of lifestyle because living at home under lockdown is quite a significant change of lifestyle, even though we are opening and some of the restrictions are being eased. So it's been a very different 4 months.
Yeah, I can imagine. We've heard that theme with a lot of parents being concerned about just the effect of, especially teenagers, not being able to see their friends. It's such a huge part of their development at that age to interact with others. So I've heard that quite a bit from a lot of people.
Indeed, yes. I mean,
Yeah.
it's quite strange with her because she's actually becoming antisocial. It's
Mm.
it's surprising. Such a short space of time is really concerning because when children, um, when they first started with FaceTime, it was a bit of fun and so on, and now it's very difficult to even get to try and communicate with their friends even electronically.
Yeah, yeah, that's tough. I know, Ryan. You have two little ones, so I'm sure that your experience has even a different dimension to it. Can you share that with us? Same
Well,
question,
similar to
personally and
Clive.
professionally. Yeah.
Yeah, well, let's start personally first before professionally. Um, my two little ones, I think the government had the lockdown since March 13th. So schools were closed on March 13th to be reopened in a physical environment in September. So we started with the online learning platform somewhere in about April, May. Um, that has been an eye opener for us. Now we appreciate the value of teachers in how important their patience and the skill sets to handle children, because I can tell you, both myself and my wife, more so my wife, we had to be relearning. And some of these simple things that you consider simple things, it's not as simple when you start to do equations and all of these things, trying to
Right.
teach from home. I think likewise with Daniel, we have been doing the whole social distancing, the hygiene, etc. I think they more than even myself and my wife have really adapted to that sanitization. I think I made the mistake and coughed sometime a month ago, and my daughter ran into the room and got the hand sanitizer and said, "You have to sanitize those hands." And she's just two. um, and when I came home from work sometime last week and made the mistake and come inside the house, my son said, "Wait, you need to go on bed. Make sure you wash your hair." So it has been really life changing. The term that has been used is the new norm.
Yes.
And I think we have really learned also the importance of what is called the assistance. We call helper or household helper because we actually had to send her home because of the whole risk of coronavirus. But boy, I tell you, we couldn't manage without her for another month, so we had to bring her
Right.
back.
Yeah.
So even her role is so much important. And I think one of the things that we have to also look at is the importance of the jobs that we don't look at. So the garbage truck, the nurse, the policeman, etc. Those jobs are so important now. They call them frontline workers, but we call them essential workers.
Yeah.
I think professionally, the GOA closed its doors on March 13th, and I think the Olympic being now officially postponed until 2021, along with a lot of the qualifiers for the Olympic Games, was also a shock to the sporting industry. And even as Clive would have indicated, the whole entertainment, photography, all of those things would have been shut down because of the whole impact of the coronavirus. I think we have now reopened our offices, and I think we have to now look at how best, because our customers, if you like, are all over the world, and likewise myself and the president would be traveling sometimes at least 20 to 25 times per year. Now we're going to really have to revisit that in terms of what it is and where do we go, when we go, and all of that. Business wise, finally, we would have been impacted. My wife has what is called canteen concessions across the island in schools. And those would have been shut down on March 13th as well. So, but in all, we give thanks and we have life and we are here today speaking.
Yes, absolutely. Well, let me take up on that because I know, for many people around the world, um, Jamaican Olympians make the game, right? And especially in track and field. So, um, how would you say that the athletes are coping in terms of both um, the mental disappointment, but also being able to sustain their training during this time?
I think it has been very, very challenging for all athletes. And I think this year we had what is called a 10 in 20 campaign for Jamaica, where we wanted 10 Olympic disciplines at one time in the Olympic Games. We have already qualified 3 different disciplines, of course, track and field, gymnastics, and swimming. But we have another 10 sporting disciplines that are actually in competition or would have been in competition to try to qualify for the Games. All those athletes have been displaced because the qualifiers have been pushed back. I think, however, in some instances where there's a disappointment, there are opportunities as well, because there are athletes that would have loved the time now to prepare for next year's qualifiers because some of them would have been carrying injuries, etc. I think the financial impact, the government and ourselves have done pretty well in trying to soften the blow because at the JOA we have stand by our commitment to assist these athletes in their Olympic qualification, tournaments and games, etc. And we have gone a little bit further to try to help them with scholarships, to help them in terms of their education, providing stipends, etc., so that the displacement financially and emotionally would have not been as great. I think we continue to support them and we will ensure, along with the assistance of other stakeholders, to ensure that the 10 sporting disciplines are at the Games next year.
Wonderful. I think that's great to hear, and I know that we've talked about the Olympics being in 2021 as opposed to 2020, so I'm sure the world is looking forward to that. So, for each of you, anyone who wants to jump in and tackle this, in the United States, we African Americans, very early on, it was rumored that black people couldn't get coronavirus for whatever reason. And I think it was probably because looking at the African countries and Caribbean countries, it seemed at first that it was tourists from European countries that seemed to be testing positive first. So I'm wondering, what was your experience sort of in your countries in terms of coming to grips with or understanding that this was a disease that could affect everybody?
Mel, if I could go first, as I said in my opening remarks, this is obviously new, but in Africa, as you know, we have been through a lot. We have seen HIV and AIDS, we still continue to see malaria, we've seen Ebola, you name it. But this is new, this is absolutely new, and nobody really knew what it was. And the first question on many South Africans' lips was, where does it come from? The minute someone mentioned what it comes from China, it wasn't just China, it was the fact that it comes from outside of the country. And in fact, it's carried by people who travel. You've had a lot of the community folks here say, well, I've never been on a plane in my life. I can't get this. And obviously because the demographics of South Africa, the folks that can afford to travel are mostly still white folk. And so because they travel, they get it. And therefore, there was that myth that black people would not be affected. And so it's just something that was new that we didn't know about, that didn't come from us. And therefore, it's something that was not going to affect us. We were not going to be infected. And so thankfully, that has evolved, and now people know that the coronavirus is real, and anybody can get it.
Yeah, absolutely.
For me, if I can just follow on, I started to see quite a number of memes and jokes and clips and so on. It's almost as if it was some type of curse that would only affect those who were not black. And that's what I was seeing in the UK, but it was really, for us, it was a disease which affected human beings, and we're the same. So I don't think for us we had this belief that it would just bypass or not affect black people, because when you named some of, and Daniel has just named some of the most severe infectious diseases, is tend to be the black nations that have been affected the most. So I personally expected that it would affect everybody, and it would probably have more of a severe effect on black people than white people. That was at a point of absolute ignorance at the time. There was no specific facts to actually prove that. I mean, subsequently, over the last 3 to 4 months, there have been a lot of evidence to back that up for varying reasons. But certainly, I thought this was going to be a virus and pandemic that would actually affect everybody.
Yeah. Well, I think, interestingly enough, it was a black Briton who I think changed the tide in the United States when Idris Elba came out. When Idris Elba came out and said that he was COVID positive, I think that really got the attention, especially of black women in the United States, if I may say so. So that was a good bit of international information exchange.
And I agree with you, because I think he was very brave to actually do so, because I think he sent out a very very clear public message that if you're black and male, you can catch it, and female, of course.
Yes, yes. Which actually brings up another question about stigma. I know some people have been concerned that, I don't want people to know that I have coronavirus, which I was actually kind of surprised about. I mean, I know about the stigma with HIV/AIDS, but are you seeing that that's the case in for example, in South Africa, Daniel, in terms of people not wanting to share that information?
Yeah, so South Africa is very sensitive with regard to the question of stigma. As I said, coming from HIV/AIDS and etc. And so, yes, there's information right now. If you ask me, what is the percentage of black folk versus white folk that get the coronavirus? That information is not available. The government does not use that in their model. They'll still talk about gender, they'll talk about age, but never about black and white. And so that's an issue of stigma. They wouldn't mention names of people that are infected. Some celebrities, like Idris have done, would come out and say, well, this is real, just to send a positive message and to say that anybody can get it and it's not your fault. It's nothing wrong if you get it. And so it's the issue of stigma in South Africa is obviously very sensitive. And so the government is doing all they can to just say, well, this can affect anybody, whether they are a South African, whether they're black, whether they're white, they're male, they're female, they're local, they're foreigner. And we need to just be able to deal with it without the accompanying negative stigma.
What about in Jamaica, Ryan?
Well, I think initially when we had our first case, I think it was roughly about March 10th. And the government did as best as they possibly can to sensitize persons as to the impact of coronavirus and what to expect. So they were pretty much prepared in terms of isolation, providing the necessary health services for that first person that I think was coming somewhere from the UK. I think, however, because the government was taking and sensitizing persons, making people aware of the seriousness of coronavirus, I think it had a negative impact initially on Jamaicans. So what you found is that persons, once they found that you had coronavirus, you were almost alienated in your community. And in some instances, we have had persons being asked to leave themselves and the family to leave, even if it's not the family member who was directly tested positive. They actually drove some of them out of the communities that they lived in. And as a result of that, many persons, even if they're showing the symptoms, did not want to come forward, which of course will allow for whether asymptomatic or symptomatic spread of the
Sure.
coronavirus in Jamaica. And so we had a big issue after the first case in terms of quarantining and as well as sensitizing persons that listen, it's a virus that any one of us can catch. So now the government, I think, has done a better job now in trying to keep persons aware of the impact and the seriousness of the coronavirus on persons. And I think similar to Daniel, they know they don't look at race, whether black or white or any other race, is more the impact, whether you are in a certain age category, whether you have underlying issues in terms of diabetes, hypertension, etc., and stick to that narrative and try to look at the positives now, because now they're trying to sensitize persons of the high rate of recoveries. I think we have about a 70% recovery rate,
Right. Yeah.
and 10 deaths out of, I think, 617 or 620 cases in the country. So I think, yes, it has been very rough because yeah, persons have actually become physical in some instances in communities, driving people out of communities because they don't want to catch the virus. So I think we have done a better job now from initially just the scare tactics, but in terms of sensitizing people of that yes, we can catch it, but let us work together in trying to get us through this pandemic.
Yeah.
Excuse me, doctor, we have a
If
question.
I may just follow up on that with a brief comment.
Mm-hmm.
The stigmatization coming from HIV and AIDS, for example, was bad because the profile is different.
Right.
It's
Yeah.
poor, it's mostly black, and but this one is different.
Yeah.
The people infected included anybody from the Prime Minister of Canada's wife, Justin Trudeau's wife, to Edward Albert, to Prince Charles, to Boris Johnson, and so
Tom
it was.
Hanks. Yeah.
It's for sure. So it's different profile, and so it's not as bad as it was with the other infections.
Yeah. Thank you.
Excuse me, doctor, we have a question.
Yes. Uh-huh.
Our question comes from Max Gregory Anderson, and it stated Great Britain's Minister had COVID 19. What impact did that have on the people of Britain?
It was a shock. It was that realization that anyone can get it, and also you got to consider that there's always this concept that somehow diseases slightly has some sort of class. It doesn't sort of breach class levels and so on. So to have someone of the profile of Boris Johnson being the Prime Minister get it was a real shock to the country, and there was a lot of heartfelt outpouring to him. In my personal view, I was in a way quite pleased. I certainly not saying I wanted him to actually pass or anything like that, because as a leader, there's an old saying that if you feel it, you know it. And I started to get the impression in terms of the messaging from our government, it was very, very clinical. And in some ways, it's almost as if we're lab rats are going to be corralled here and corralled there. And that whole personal approach to individual medical care and providing the best for everybody seemed to be getting very, very diluted. And I thought, great, because if you feel it, you know it, and then Prime Minister Johnston will begin to do things very, very differently and a lot more carefully. And a great quote from Andrew Como, when I see his new broadcast, he says quite a lot, loving. And I think I was certainly hoping to see the transition with him and in terms of the government approach. And in a lot of areas, you could see that real softening as he actually went through it. And unfortunately, he was very, very close, but luckily he survived. I think the whole country was very, very happy to see him survive. So yes, it showed that anyone could actually get it, and in certain areas it changed the viewpoint of the government as how they approached it.
Excuse me, doctor, we have another question. Our question comes from Tracy Walls. Do you think individual countries will try to develop a vaccine on their own, or will they work together since this is a global virus?
So, Tracy, I'm in South Africa, as you may have heard. One of the early controversies was that the vaccine was going to be tested in Africa, was sort of Africa should offer itself up for testing. There was a backlash against that kind of view because of the historical medical research abuse and discrimination. Do I think that Africans should be tested? Sure, but not in the way it has been done before. It must be done in a way that is highly regulated with careful scrutiny so that we're not just guinea pigs. Africans should indeed participate in the research and the development of the vaccine, join the global effort because, number one, it helps us join the universal effort to fight the virus. Number two, it upscales our knowledge. It gives Africans an opportunity to develop knowledge, research knowledge, and the development of vaccines for the future, especially on a continent where various types of viruses show up now and then. So we should not be excluded. We shouldn't be used as guinea pigs, but we should also not be excluded from participating in the development of the vaccine. As I say, in that way, we could join the global effort as well as develop our own capabilities and skills in this regard.
I think that was excellently stated, and I just wanted to add, here in the United States, there's a concern because I've seen some things regarding what Melinda Gates has said about healthcare workers should get the vaccine first, and then black people in the United States should get the vaccine. And I think there's a similar concern, too, that if the vaccine is deployed early and it's not well tested, and then you're the first sort of group outside of healthcare workers or black people, there's a general reluctance to, because of those same issues of medical research abuse in the past, and that there should be historically black colleges and universities working on the vaccine as well as on the testing and the recruiting of participants to participate in trials, as well as the deployment for once it is ready for prime time. And I think that's probably the case internationally, that no one group based upon race or geography, since this is a worldwide issue, should be singled out, that everyone should equally have access to and have some sort of role in developing the vaccine and the trials. I want to pick up on it. Oh, I'm sorry. Go ahead.
Excuse me, doctor. We have another question. We have a question coming from Ellen Claire Lamb. How do people get access to testing? Did the panelists countries have the same shortages of tests and equipment that the United States did?
Clive, do you want to take that first?
Oh yes, absolutely. I watched quite a lot of international news, different channels, and we had exactly the same issues in terms of getting the individual components to be able to actually take the test, who was actually going to do the test, whether the test would be trustworthy, how many tests we could actually have. And even now, we're still only around the 100,000 a day, and so beginning of April, around April time, our government said we'd be at around 100,000 towards the end of April. Coming into May, we're now in the middle of June, and we're still pretty much at exactly the same level. So yes, we had exactly the same problems as everyone else had.
I think in Jamaica as well, initially, we had issues in terms of getting access to the tests, as well as the volumes in terms of our ability to test. I think in the latter part of the pandemic, in terms of the spread in Jamaica, I think we have done much better. And I think we are now testing. Well, we see now that we have opened up our borders to tourists, albeit in a controlled manner, and all tourists will be tested So our ability to test has been improved. And I think initially we had, as Clive had indicated, we had issues in terms of our ability to test in mass. But now I think the government has done a better job in terms of expanding the amount of tests and who we test as well, because there is a cost to testing that, coming from a third world country. We would not be able to have that ability to be testing at that level, albeit we have 3 million persons within the population. So yes, we had issues at first, but I think with a control environment and protocols and strategies implemented by the government, we have expanded our reach in terms of who we test, when we test, and our ability in terms of the quantity has also significantly improved.
Can you elaborate a little bit on the point about today is the day actually that the island is open up for tourism, actually coincidentally. Can you expand on, you mentioned that tourists are going to get tested. Are they getting the rapid, the same day test, or do they have to quarantine until the test result comes back? Do you know how that's being handled?
Yes, well, a couple of things. I think that's one of the biggest points and biggest talking points in the country right now in terms of allowing tourists, especially given that the first case of the coronavirus in the country was imported. The majority of the cases that we have seen have either been localized or imported. And of course, through contact tracing, we have seen a lot of the issues and the number of cases increase. However, tourism provides 350,000 jobs for Jamaica. And we have a population of about 3 million. So that's about 11% of our overall population is employed to the tourism sector. So the government had to make a decision in terms of finding that balance between lives and livelihoods. And as such, they took the decision to allow tourists, of course, in a controlled environment, because they are now allowed to stay within what is called a tourism corridor. So they only can enter the island via Negril Point to Portland Point. So they're not allowed within the Kingston, Clarendon, etc. region. Yes, they get the rapid tests. However, they are not stationed at the airport. They are quarantined or isolated within a zone within the respective hotels that they would be visited. Once that result comes back which is the 24-hour, if they're negative, then they are allowed to move about within the corridor as well, within the areas within the hotel that are approved for tourism. If they are positive, then they are required to be isolated either within the hotel or to a government quarantine facility for the respective period. I think 2 weeks before they're allowed to travel again. So yes, it's a risk that the country is taking, but I think nothing is perfect and we have to start somewhere. And I think the fact that they have implemented in terms of from the transportation point from the airport to the hotel, all those transporters are also social distance within the vehicles, buses, etc., that are carrying these tourists to the airport. They are also required to wear masks, sanitize, etc. And so they will be tested now to see how that works, if there is any community spread within the confines of the tourism sector, because not all hotels are open. I think roughly about 25 thereabout have started, and then gradually will increase dependent on the outcome of what comes from these testing.
Got it. I smile because unless you plan on taking a 2-week vacation, you better make sure you're COVID negative before you travel to Jamaica.
Excuse me, doctor. We have another question. Our question comes from Renee Roxborough Moore. How has South Africa and UK catered to the most vulnerable in their societies? Have they implemented any new programs, policies to assist with stipends, housing, food for those that are displaced?
Excellent question.
Clarke, do you want to go first?
Yeah, let's
Yes,
start.
please do.
Quickly, just writing down the question. Within the UK, we have a number of things which have actually been implemented. I really want to talk about the ones first, which have been implemented and supported by the public. And we always got a history of charity and supporting charities, and there have been two major ones which were launched at the beginning of the lockdown. There was a national one, and they wanted 250,000 volunteers nationally. They had 750, and then there was the local ones in each borough. And what these would actually do, people would actually put themselves forward. They would be security checked and screened, and they would be providing support for those people who are vulnerable or who have been in quarantine. And this may be to get medication, be able to get and deliver food to these individuals who are unable to actually leave their house. The government has also implemented, which I think has been absolutely fantastic, the response of the communities in supporting each other. Following all the social distancing rules and PPE actually provided, so everybody was safe. The government has also, as part of the legislation they released under lockdown, they brought in some measures such as if you were paying rent, you could not be taken to court to be evicted for non-payment of rent, because obviously the impact on your financial situation has been very severe for some people, until after they declare that the actual pandemic and the risk is over within the country. It's the same for those who have mortgages. Everybody's been given a 3 months mortgage holiday, so you don't have to pay your mortgage for 3 months, as well as all the other furlough type payments, which I think a lot of other countries have followed throughout the world. So there has been a tremendous amount of support driven and maintained by community volunteers in actually helping anyone and everyone who has been affected with the virus and the lockdown.
Great, thank you.
And for South Africa, we've done everything, most of what Clive was talking about, but like Ryan mentioned about the need to balance lives and livelihoods. The South Africa's response was really a very hard lockdown. And you're locking down people who live in the shanty towns and the slums. You have no jobs, you have no food. So the government provided a special grant, a special amount of money to people that are unemployed. For those that are already on the social welfare system, they increased their monthly grants for the next 6 months. And they started distributing food parcels for those that were required to social distance but not to leave their homes, but that need to go out every day to go and hustle. So the government was good at providing some food. It was inadequate. Obviously, they were not able to reach everyone, but NGOs also stepped in to make sure that they can mitigate the risk, because people did not have to choose between dying from the coronavirus or from hunger.
Got it. Okay, thank you. And for those who don't know, in South Africa, the shanty towns are historically areas where during apartheid people were segregated. They were in proximity to the large cities where mainly whites lived, and that was basically the labor force that came in to do the essential frontline worker jobs in the cities. And they persist. I know that South Africa is working on improving them, but they're still there, and I think they tend to be the areas that have been hit the hardest by COVID-19, if I'm not mistaken. Is that right, Daniel?
Indeed, they are. They're the hardest hit, obviously, as I said, because people are not able to practice social distancing. The healthcare system infrastructure is inadequate in those settlements, and so indeed, those are the hardest hit.
Sure.
Excuse me, doctor, we have a final question.
Okay.
Our question comes from Angelique Proctor from Max Gregory Anderson. She asks, Cuba has outsourced many of their doctors to help other countries. Have they been to your country? And if so, can you describe their contribution and impact?
Well, I think I could go first. I think, yes, we have benefited from the partnership with Cuba in many regards. And from coming as the head of the JOA, I think even in sport, we have benefited significantly from partnerships and MOUs with Cuba. I think over a month ago, Cuba had sent or have sent about 120 or so doctors, physiotherapists, nurses, etc., to assist Jamaica in the fight against coronavirus. I think that has significantly helped us because at one point the numbers were rising exponentially because we were at about 17 thereabout for about a good while. And then we had an outbreak in a particular company, which resulted in about over 250 of the 600, over 600 cases that we have had in the islands thus far. So yes, the partnership with Cuba has been significant, and we will forever be grateful to Cuba and its assistance to Jamaica in the fight against coronavirus. I think likewise in South Africa, Jamaica has what is called ghettos or slums. Surprisingly, and God's willing, we have not had an outbreak because in some communities we have practically 10 members to a room. In some instances, are 2 rooms. But we have not had an outbreak of the coronavirus within these communities. So we have to be really thankful because a lot of our people, a lot of the Jamaican people will reside in these what you call inner city communities. And we have to be very grateful, as I said, to the expertise that Cuba has also given to us. I think they themselves have been looking at a vaccine as well to fight the coronavirus, and that's something I'm not certain if it has been approved, but I think they have seen some success already in Cuba with the use of this particular vaccine.
Wow. Well, I think we are at the top of the hour. This has really just flown by. I have really enjoyed talking with all of you. I think that's a great note to end on. Thank you for that summary, Ryan, of that international cooperation. I think this international discussion has been very enlightening for everybody. Again, I want to thank Daniel Ngwepe from South Africa. 4 a.m. there now.
It
Clive,
is indeed.
Clive Thompson from the UK, 3 a.m. there now. Ryan Foster from Jamaica. It's an hour behind us, the East Coast, but he needs to go celebrate his anniversary. So thank you, gentlemen, so much for joining us. We really appreciate you.
Great pleasure to be here. Man.
Absolutely.
Thank you very much. And, yeah, go have
All right.
fun, right?
All right.
Clive,
Nice meeting you guys.
Nice.
All right.
Nice to meet you too.
Yeah.
And
I'll have early breakfast.
yeah, early.
I'll have
so
late
Joy-
dinner.
Right, there you go.
I'm going
There
to
you
work
go.
soon.
And Clive, you can go back to sleep. All right, gentlemen, thank you so much. And to our audience, thank you once again for tuning in this week. Looking forward to hearing from you and seeing you next Monday, same time, 9 p.m., Facebook and YouTube Live. Remember, YouTubers, please hit that subscribe button. And until then, please remember, you can catch me tomorrow morning on the Russ Parr Morning Show. For those in the U.S., or actually it's on the internet, you can tune in at 7:45 a.m. And until next week, remember, please be wise, be well, and be health empowered.